You're watching WDEF News 12 this morning with Rachel Esch, meteorologist Brian Smith, and your time-saver traffic tracker with Sunny 92.3's James Howard.
Good morning. It's time for house calls with OBGYN Dr. Mark Steele. If you have any questions about women's health, the number to call is 756-1212. Give us a call at 756-1212 if you have questions. Thanks for joining us.
Good to be here.
We do have some folks on the phone lines, but before we get to that, there is a vaccine that we need now, or some of us need.
It's a vaccine. It's a booster for pertussis, for whooping cough. Infants below 1 year of age are really not protected for it with their vaccine schedules, and where they pick it up from is their adult caregivers. And it can be, while it's pretty mild in adults, it can be even fatal in infants. So we need to keep them from getting the disease in the first place. And so the adults are needing the boosters. We're especially targeting women after they're done with the pregnancy, or preferably before pregnancy. So
something to think about, especially there's a lot of grandparents now caring for young children. They might need one as well.
Right, and of course the dads too. So grandparents, dads, so not just the women.
Let's go to the phone lines now where Lisa is our first caller. Hi, Lisa. Lisa?
Yes, I was in the hospital this past weekend. I've been having trouble with pain in my stomach. And they gave me a possible diagnosis of ovarian cancer on my right ovary. What kind of test can I look for them to be doing now?
Well, if the suspicion is definitely that there's ovarian cancer, the ovary would have to be removed. And that's really the only way to find out if it's actually cancer. At the time of surgery, they would do what's called a frozen section, where they take a look at it right there at the time of surgery. And if it's benign, if it's not cancer, then that would, of course, be good. If it is cancer, then that would dictate additional surgery.
Let's go to the phone lines where Christy's joining us now. Hi, Christy.
I have a question.
Go ahead.
I have a question. I have had surgery this year. I've had my uterus removed, and I've had my ovaries removed, and I had a lot of problems, but I'm still having a lot of pain. Do you know what that might be?
Well, it's possible that the pain wasn't related to the uterus or the ovaries, and therefore you'd have to look at other possible causes for the pain. After surgery, you can have pain from adhesions, which are a form of scar tissue that can form after any type of surgery, and that would have to be looked into as well. But if the pain didn't get any better at all after the surgery, I would start looking at other causes for the pain.
Let's go to Irma now. Hi, Irma.
Yes. I want to know, how old do you have to be for the change, the menopause get off of you?
The average age for menopause is 50, but certainly a lot of women go through earlier than that, some even as early as in their 30s and 40s, and then some women go past 50. There are usually pretty typical symptoms that go along with it. Sometimes in women who have had a hysterectomy and don't have periods anymore anyway, you might need some blood work to determine if in fact you are menopausal.
Let's put the information on the screen for you now. Of course, if you have any more questions, women's health related, you can always give Dr. Mark Steele a call. He is on Gun Barrel Road. The number to call is 899-9133 if you want an appointment or more information, 899-9133. We also want to remind you to always talk to your doctor before making any health care changes. Dr. Steele, thanks for joining us.
You're welcome. My
Appreciate it. Stay with us. We're going to take a short break and be back. This is WDEF News 12 this morning.